cardiovascular system, or circulatory system, is all about the heart, the blood vessels, the blood pressure, and this controls how everything gets around the body. Most of the things that we need in every living cell, like nutrients, gases, taking waste away, it all travels through the circulatory or cardiovascular system. And this is a network similar to a motorway or an A road or a B road, or if you live in Devon, a little country lane. So these vessels that travel around the body are taking our nutrients and our waste products and our hormones around the body and delivering them to every living cell, and taking things away from every little cell as well, and disposing of it in the kidneys where the blood is filtered. So this is the cardiovascular system. Where 5 questions in your exam paper. The ITEC focus is very much about knowing the structure of the heart, how blood goes in and out of the heart, and what type of blood it is, whether it's oxygenated blood or whether it's deoxygenated blood. Got a lot of questions about the different vessels and what size they are, what their names are called. So it's a fascinating subject. I loved the cardiovascular system, and I hope you will as well. We have about 4 to 5 litres of blood travelling around the body at any one time. We're going to talk over this presentation about the heart and how blood moves through the heart. The blood vessels, there are different types of blood vessels. The biggest blood vessels in the body are the arteries, and the biggest artery is the aorta. Arteries then get smaller as they travel away from the heart, and they become arterioles, and they are baby arteries, and it's arterioles that maintain blood pressure. Now the capillaries are smaller again, and the capillaries take blood into every living cell, deep into the tissues and the extremities of the body. Capillaries can be oxygenated, they can carry oxygenated blood, but they can also carry deoxygenated blood. And as they're giving off oxygen into the cells, they will be picking up carbon dioxide from the cells as a waste product, and then they'll be taking that back to the heart, and from the heart to the lungs. So the capillaries then get bigger again, because by this time they are carrying a lot of carbon dioxide. They will then get bigger, and baby veins are known as venules, and venules then become bigger again as veins. Now the veins then, the biggest veins in the body are the pulmonary veins and the vena cava. So the blood vessels are arteries, arterioles, capillaries, venules and veins. Now systemic circulation, we have different types of circulation around the body. The systemic circulation is around the whole body and takes blood all the way around the body. But pulmonary circulation is about taking blood from the heart to the lungs and from the lungs back to the heart. So pulmonary is a word that very much is associated with the lungs. The Latin name associated with the heart is always cardio, but pulmonary is associated with the lungs. Coronary circulation is the blood supply to the heart itself, so in and around the heart itself, because obviously the heart would die if it didn't have its own oxygen supply and blood supply bringing in nutrients to it. Then we're going to talk about the pathology, which is the diseases and the disorders of the heart and the different blood vessels. The blood is composed of 55% plasma. We've already come across plasma before because we talked about the plasma coming out of the blood into the interstitial fluid and then turning into lymph as it went into the lymphatic system. So plasma is a straw-coloured fluid which is in the blood, The other 45% are blood cells, but the plasma is responsible for transportation. So within the plasma, we have 7 different things that travel in the plasma of the blood, and we need to try and remember those 7 things. So in the body we need to have mineral salts. Now mineral salts are responsible for balancing the body and nerve conduction. So for nerve conduction, it's a chemical reaction quite often, and we need mineral salts for that to happen. We also need to have a pH balance in the tissues and cells throughout the body. So that balance, that pH balance, is between whether something is too acidic or too alkali. And in certain places in the body, we need a high pH balance, a high acidic pH, so that we can kill off bacteria. Bacteria don't like high acid levels in the body, but enzymes do. So in the digestive system we have the hydrochloric acid and we have a very high acidic pH. So mineral salts like sodium chloride, potassium, magnesium, phosphorus, calcium, iron, copper and iodine are very important for nerve conduction and the pH balance of cells and tissues. The second thing that's carried in the plasma are nutrients. Now, nutrients are either amino acids, fatty acids, glucose, glycerol, vitamins, and they are all absorbed by the plasma proteins in the blood, and they are used for cell tissue energy, repair, reproduction. Amino acids, another name for that is proteins, fatty acids is fat, glucose, glycerol, sugars. So we need all of those for cell tissue energy, repair and reproduction. The waste products that are removed travel in the plasma. So the waste products like urea, too much urea in the body causes problems. Urea is a byproduct of protein metabolism. So waste products like urea are produced in the liver, and then they're sent to the kidneys and then excreted through the bladder. The fourth is hormones. All our chemical messengers from the endocrine gland travel in the plasma in the blood, and the hormones are responsible for changing or influencing different organs and the activity and behaviour of the body. So quite often the hormones are either stimulating or inhibiting an action in the body. Enzymes, these are protein chemical catalysts in the body that set about a change or speed up a chemical change in the body. So enzymes are travelling around the body. Gases like oxygen and carbon dioxide, they're dissolved in plasma and they travel around. Antibodies and antitoxins, which we've talked about in the lymphatic system, these are part of our body's protection, and they're produced by the lymph glands and travel around in the plasma of the blood, ready to fight infection. So to recap, we have mineral salts, nutrients, waste products, hormones, enzymes, gases and antibodies travelling around in the plasma of the blood. The other 45% of the blood is blood cells. We talked about cells and blood cells in particular in the cells and tissues section, so this should be revision for you. The red blood cells are known as erythrocytes, and they transport oxygen around the body. They're produced in the red bone marrow of the bones, and their colour comes from a substance called hemoglobin. Now, their lifespan is 120 days, so they are produced in the bone marrow, broken down in the spleen, and then they're sent to the liver, where the liver recycles them and turns them into bile. So you do need to know about the life history of the erythrocytes and what they do. So they carry oxygen. The colour comes from haemoglobin. And if they're not working properly, if the erythrocytes are not carrying enough oxygen or the haemoglobin is limited, we can suffer from anemia. So anemia is in the body is a problem with the ability of red blood cells to carry enough oxygen or to have enough haemoglobin, or whether we have enough iron in the body. So these are all related to having anemia, but you'll learn about that later on.
So leukocytes are the proper name for white blood cells, and leukocytes protect the body from infection. So when there's a serious infection, our white blood cells perform mitosis and multiply very, very quickly in order to increase the amount of white blood cells that we have to fight off an infection. And when the doctor takes your blood when you are feeling poorly, they can tell by how many of the white blood cells have reproduced and the number that are present in your blood as to how extreme the infection is that you've got. So mitosis is a process that reproduces white blood cells and increases your army, as it were, so that when you are suffering from an infection, the right cells are reproduced to fight off that particular infection. So funnily enough, Lucozade got its name from leukocytes. The company that makes Lucozade took the name from leukocytes in order to imply that if we drank Lucozade and we were feeling ill, that would help us on our way to recovery. So this is a classic example of products on the market being named after real infection fighting cells in the body. So when we have an infection, these leukocytes multiply and increase our army so that they can go out and fight infection for us. So there are different types of leukocytes. And when we have an illness, so if we have about a flu, for instance, we produce the right white blood cells to fight that particular infection. So that if we get exactly the same thing again, then we already have the antibodies in the body that can fight that infection. So we have granulocytes, which defend against an invasion by any microorganism, and about 75% of our white blood cells are made up of granulocytes. And when they come out of the blood into the body, into the tissues and the cells or the digestive system, they're attracted by the toxins and waste products that a particular virus or infection will leave behind it. So they leave like a little bit of a trail of debris that these white blood cells follow in order to find them and to ingest them. So then we also have non-granular leukocytes. Now these are the leukocytes, the antibodies that are made in the lymphatic tissue, and the antibodies that we already have, which came from our mothers through the mother's milk when we were a baby. We have these antibodies that are passed from mother down to baby. We also then develop our own as we go through childhood, and we have the mumps and the measles and the chicken pox or any other disease along the way. We produce our own antibodies to fight off infections that we might have again. And then we have a group called monocytes, and they eat the bacteria. They ingest the microorganisms, the bacteria, the foreign bodies, and that process is called phagocytosis. Now, we've already talked about phagocytosis once during the cells and tissues presentation, and this is where the white blood cell surrounds and ingests the bacteria or virus and kills it that way. And I often think that if you look at a video on YouTube of phagocytosis as part of your learning, then it looks like an episode of Doctor Who. Thrombocytes are also known as platelets. Thrombocytes are cells in the blood that are responsible for clotting the blood. They're formed in the red bone marrow, and when a blood vessel is cut or breaks, they disintegrate and they seal the clot and cut by producing an enzyme called thromboplastin. If you can think that these days, if we have a cut or we have any bleeding, we put a plaster on it. Again, this is where the term plaster came from, is because thromboplastin is the first enzyme that's released when the thrombocytes rush to an area where there's a cut or a break in the skin, and they produce this enzyme to seal. And the thrombocytes disintegrate to seal this cut and block any bleeding from that site. So the thrombocytes are responsible for clotting blood. With thromboplastin is the first enzyme that's responsible for sealing this. And later on, when you hear about haemophilia, haemophilia is a condition where there is a genetic problem with sealing and stopping clotting in the blood. And there are a lot more enzymes produced which form a clot, like prothrombin and fibrinogen, and haemophilia is lacking one of those main procedures in the clotting mechanism, so that they carry on bleeding a lot longer than any of the rest of us.
So the functions of the blood, we have 4 of them. We've already talked about the transportation of nutrients, enzymes, gases, and the removal of waste. That's your first function. The second one is, again, what we've talked about, the defense and fighting infection of the body by sending out leukocytes and antibodies to fight off bacteria and viruses. We've also talked about the clotting of the thrombocytes and the seal they put over any cut. But the fourth one, which we haven't talked about so far, is the regulation of temperature. When we get particularly hot, we become a lot more aware of our blood vessels. They seem to come to the surface of the body and they vasodilate. That means they get bigger. And they get bigger so that they can give off the heat from the blood. And they can cool the blood down by increasing the surface area. And vasoconstriction happens when we're cold. And when we're cold, the blood vessels seem to disappear. It's very hard to find a blood vessel on the top of the skin when you're cold. They dive down in order to, and constrict in order to hang on to all the heat that the body has so that we don't get too cold. So that's how we regulate temperature through the blood. So the functions of the blood are transportation, defense, clotting, and regulation of temperature. Blood clotting is quite a complicated process, and the necessary components for good blood clotting are prothrombin, calcium, thromboplastin, an enzyme called fibrin, which is one of the blood clotting albumin proteins that we find in blood, and vitamin K. Vitamin K we get from green leafy vegetables. Now, quite often when we have a platelet deficiency or a thrombocyte deficiency in the body, this can be as the result of bone marrow disease. So that would affect the clotting of the blood, the bone marrow disease and the thrombocyte deficiency or platelet deficiency. Also, we have a condition called haemophilia, which is a lack of one or more of these components that help to form a successful clot. And haemophilia we'll talk about later on a little bit more in detail. The absence of fibrinogen, which is also a plasma protein that we find in the blood, fibrin and fibrinogen are responsible for clotting the blood. A lack of vitamin K affects the production of prothrombin, so we do need to make sure we have plenty of vitamin K as well as calcium. And excess fibrinogen in the body then can cause too many clots, and that can be highly dangerous because somebody who has too many clots could end up with a stroke, a deep vein thrombosis, or a heart attack if the clot manages to lodge itself in the heart. So we do need to understand that it's a complicated process. There was a time when we would have to learn the phases attached to clotting and the process of clotting, which is down the bottom there: thromboplastin, prothrombin, thrombin, fibrinogen, fibrin forms a clot. Luckily these days we do not need to know to that degree, so I wouldn't worry about that. But if you could have just an overview of the fact that prothrombin and fibrinogen are very important in a clot, that would be lovely. The heart is divided into 4 chambers, 2 at the top and 2 at the bottom. The 2 chambers at the heart are called the left and right atrium, and the 2 chambers down below are the left and right ventricles. The left and right side of the heart are divided by a muscle wall called a septum, and the tricuspid valve can be found between the right atrium and the right ventricle, and the bicuspid or mitral valve can be found between the left atrium and left ventricle. The heart is made up of 3 layers. The endocardium is the inner layer. This is made of epithelial tissue and is friction free because we want the blood to rush through the heart as quickly as possible and not get caught up on any rough edges anywhere. Endo means inside, and if you have an endoscopy, it means they're going to put a scope down into your mouth, down your throat, and have a look around and see what's happening. So endo means inside. The myocardium is the middle layer, myo meaning muscle, cardium meaning heart. So the middle layer of the heart is the myocardium. Pericardium, up periscope, is to have a look outside. So outside or around the outside of the heart, that layer is called pericardium.
The flow of blood through the heart always starts with deoxygenated blood. This is the returning of blood from around the body back to the heart to be replenished with oxygen. So we always start with the vein, and the biggest veins in the body are the vena cava or the pulmonary artery. So the inferior vena cava, which we can see on the bottom left of this picture, collects all the deoxygenated blood from the body, from the lower part of the body, and returns it to the right side of the heart. And at the same time, the superior vena cava, which we can see at the top left of this picture, is collecting all the deoxygenated blood from the top of the body and bringing it back to the right side of the heart. So they meet at the heart on the right side, on the right atrium. Now the right atrium then goes down into the right ventricle, and then briefly we're going off to the lungs with the pulmonary artery, which is the only vein that carries deoxygenated blood. That goes to the lungs, replenishes the blood with oxygen, and then comes back to the heart into the left atrium through the mitral or the bicuspid valve, because it has 2 names, down into the left ventricle, and then the aorta takes the blood out of the heart and replenishes the rest of the body with oxygenated blood. So in brief, we're talking of the vena cavas returning deoxygenated blood to the right side of the heart through the valve into the right ventricle, off through the pulmonary artery to the lungs to replenish with oxygen. And then once that's happened, the blood comes back to the left atrium through the pulmonary veins, which we can see there on the right hand side, these little veins coming into the left atrium, comes down through the valve into the left ventricle and then up through the aorta and around the body. So a bit more specifically, as I said, it's the inferior vena cava that takes the blood from the bottom part of the body below the heart, and superior vena cava brings deoxygenated blood back to the heart and into the right atrium. Now the valve between the right atrium is the tricuspid valve, and that has those three flaps to allow the blood through into the ventricle, and the job of the valve is to stop the blood rushing back. It then goes from the right ventricle, up through the pulmonary artery to the lungs, where the blood is exchanged by diffusion with the alveoli, and the carbon dioxide is given off through the lungs into the atmosphere, and the oxygen is absorbed through diffusion into the blood. The pulmonary veins then return it to the left atrium, and it passes then through the left atrium, through the mitral or bicuspid valve into the left ventricle. From the left ventricle, we then see here the aorta that comes up. Now there's an arch over the top of the heart that divides into two arteries. One is the ascending aorta that goes up to the brain and the top part of the body, and then we have the descending aorta, which you can see here at the bottom right of the picture, that takes the replenished oxygenated blood around the body below the heart. If you have a look at the aortic arch, you can see there's some little arteries coming off the aorta there. Now they are the coronary arteries, and the coronary arteries are responsible for replenishing the heart itself. So they double back from the aorta, come into the actual heart itself and replenish all the cells in the heart and make sure that the heart itself has oxygenated blood.
The heartbeat is the name given to the muscle wall contraction. The heart is controlled by the automatic nervous system or autonomic nervous system. The atrium both contract at the same time, so the top of the heart contracts, forcing the blood into the ventricles below, and then the ventricles contract, forcing the blood into the arteries. So the right side of the heart would be forcing the blood into the pulmonary artery, and the left side of the heart would be pushing the blood into the aorta. Then the ventricles relax and the heart rests and dilates with fresh blood. So this sound of the heartbeat, ba-dum, then you have a gap, ba-dum. This is the heart contracting at the top, then the bottom, and then resting. And they used to call it lub-dub, lub-dub, lub-dub. So the heart contracts at the top, pushes the blood into the bottom, the ventricles, then the ventricles push the blood out into the arteries, and then the heart relaxes and fills with blood. Now, when the heart is contracting, this is called the systolic blood pressure. When the heart is resting, this is called the diastolic blood pressure. Now the diastolic, if you take a blood pressure, you've got one figure over another. So my blood pressure, for instance, might be 140 over 68. The top figure of 140 is the systolic. That's the blood pressure when my heart is contracting. And the bottom blood pressure is 68. That's the diastolic. That's when it's resting. It's important that the diastolic is nice and low because that will indicate how much stress the heart is under. So it's quite useful to know what your blood pressure is. The systolic is often 100 plus your age, just as a rule of thumb. So if you're 50, your systolic on average might be about 150. If you're 80, it might be 180. And the systolic tends to go up and down quite readily when we exercise. When we're sleeping, it might go down. We'll just run for a bus, it'll go up. So that goes up and down. So blood pressure is maintained, and it's what we call at a consistent level. So if your blood pressure just inflates once, it doesn't mean to say you have high blood pressure. Your blood pressure has to consistently be high. And blood pressure, the diastolic, is considered 90 or above for a diastolic is considered to be high blood pressure. So if your blood pressure is 240 over 110, then that would be considered high blood pressure. And they would take your blood pressure and monitor it on a regular basis and see if it's consistently high. And if it is consistently 90 over or above, then you would be put on blood pressure medication. Normally you would be taking that for life. Occasionally, when you have a change of job or you retire or you do make a life change, then sometimes you can come off those tablets for a period of time, but normally you would take them for a lifetime. Now the sinoatrial node is the pacemaker or heartbeat starter. That's a sinoatrial node. And the pulse is known to be the rate of the heart dilating in an artery, and it reflects the rate and rhythm of the heart. And the average heartbeat or pulse is 72 beats per minute. This will be lower when you're resting, and it'll be higher when you're exercising. The heartbeat changes in response to the following: exercise, age, the size of the heart, the emotions, temperament, and disease. And the exercise increases the heartbeat and it slows down with rest. The age that you are makes a difference to your heartbeat. It's faster in infants, about 130, and then it slows down with age. The size of the heart makes a difference, and when it decreases with size, so does the speed. And a heart is normally about the size of your fist. But obviously, like any muscle, the more you use it, the more you exercise, the bigger and larger it can become. Emotions make a lot of difference. So if you're excitable and you're running quite stressed and you've got a lot of adrenaline pumping around through the body, then your heartbeat will increase. And likewise, if you're resting, then again your heart rate will decrease. But your temperament makes a lot of difference. Some people are excitable and they have a faster heart rate. Other people are more placid and very slow, and their heartbeat will react to that. Disease also makes a difference to how quick your heart is beating. And it'll be faster if you have a fever or a hemorrhage or you're hypothyroid, and it'll be slower if you're suffering from jaundice, heart block, or you have pressure on the brain. We have three types of circulation. We have the pulmonary circulation, which happens from the right side of the heart to the lungs, and from the lungs back to the left side of the heart. Deoxygenated blood enters the atrium from the superior and the inferior vena cava. It then travels from the atrium through the tricuspid valve into the right ventricle. From the right ventricle, the blood travels via the pulmonary artery to the lungs. You then get an exchange of carbon dioxide passes into the lungs, and oxygen then from the alveoli into the blood vessels by diffusion. The oxygenated blood then passes back to the heart by the pulmonary veins into the left atrium. That is your pulmonary circulation, and you need to know this flow of blood. Systemic circulation then happens from the left side of the heart, through the mitral valve from the atrium to the ventricle, and then it leaves the left ventricle via the aorta, which then branches into the ascending and descending aorta and all around the body. There is a little portal circulation which is unique to the stomach, the spleen, the intestines, and they merge to form the hepatic portal vein, which takes blood to the liver. This is where our nutrients are extracted from the digestive system, from the food we've just eaten, and passed to the liver, first of all, for distribution. The direction of flow in the blood is controlled by the semilunar valves in the aorta and the pulmonary artery. They are just two arteries that have semilunar valves to direct the flow. In the heart, the two valves are the tricuspid and the bicuspid. Coronary circulation is about the heart's own blood supply. So the coronary arteries, the left and right, leave the aorta to form a network of capillaries which feed the heart and provide it with nutrients. Then the coronary veins take the deoxygenated blood to the right atrium for replenishment. Let's just recap the flow of the blood through the heart. The inferior and superior vena cava return the blood to the heart, the deoxygenated blood, to the right side of the heart. It gets deposited into the right atrium, travels through the tricuspid valve into the right ventricle. It then travels through the pulmonary artery to the lungs, where the oxygen is taken up from the lungs and the carbon dioxide is sent into the lungs by diffusion. The pulmonary vein then returns the oxygenated blood to the left side of the heart into the left atrium through the bicuspid valve into the left ventricle. This then leaves the left ventricle via the aorta, which then divides into the ascending and descending aorta and sends oxygenated blood to every cell in the body. That's the flow and circulation of blood through the heart, which you do need to have a firm grasp of. This is a diagrammatical drawing of the flow of blood. We can see in the left hand side, this is the pulmonary flow between the heart and the lungs at the top, and then the bottom is the systemic flow of blood around the body. And in the middle we can see the blue vessels depict the deoxygenated blood and the red depicts the oxygenated blood. If you actually look at your veins and arteries, though, they are not blue and red. They might go a bit darker. Venous blood is a lot darker, but oxygenated blood again is bright red, but they're not really blue or red. The arteries are the largest blood vessels in the body that carry oxygenated blood. The exception to the rule is the pulmonary artery, which carries deoxygenated blood to the lungs. But the arteries carry blood away from the heart. An artery has a thick wall and a hollow tube in the middle. Now, the hollow tube, the space is called a lumen, and it's said that arteries have thick muscle walls with a small lumen. The endothelial layer, the inside layer, is composed of squamous simple epithelium, and the muscle layer is the middle layer, which is also made of elastic tissue, and it has a fibrous outer covering. Now, the arteries are the biggest blood vessels that carry oxygenated blood. They get smaller into arterioles. Arterioles are known as small or baby arteries, and they have a middle layer with an involuntary muscle in them, which is controlled by the vasomotor nerve. That nerve controls whether it dilates or contracts. The arterioles always have a slight degree of contraction, and this helps to maintain the blood pressure in the body. When an organ needs more blood, the arterioles contract and dilate to send blood into the stomach and after exercise. The hormones like adrenaline, noradrenaline, vasopressin contract arterioles, and they will make the blood faster. In shock, this might cause the arterioles to relax, which is why the blood pressure lowers. So in this slide you can see the arteries and the arterioles.
The capillaries are the smallest blood vessels in the whole body. And as we can see in this picture here, we've got the red arterioles pushing blood into the capillaries, and as the capillaries give the oxygenated blood out to all the cells in the body, then they are deoxygenated capillaries, which push the deoxygenated blood into the venules and then the veins. So capillaries are the smallest blood vessel. So quite often we might have a few broken capillaries on our face, but capillaries take the blood to every smallest little part of the body. But the walls of the capillaries are only 1 cell thick, so they're very porous, so that they can allow the blood out into each individual cell very easily. But because of that, they crush quite easily, so we can damage capillaries very easily by squashing them. So crossing your legs is not a good idea, crossing your feet over, because this tends to long term break the little capillaries that we have closest to the skin. So the capillaries, because of this very porous cell lining, they allow the passage of oxygen and carbon dioxide and nutrients into each individual cell very easily. Large amounts of water in the surrounding interstitial fluid in between each cell and tissue bathes the walls of the capillaries and also the cells. So this is called interstitial fluid. And it's the interstitial fluid that delivers nutrients throughout the body and collects waste products for elimination. Capillaries supply every part of the body except the brain, the hyaline cartilage, and the epidermis, where they're not present. We have larger vessels for the brain and the hyaline cartilage and the epidermis. So these are very small, 1 cell thick, and extremely porous.
Venules are small veins. They have very thin walls but a very large lumen. The job of the venules is to carry deoxygenated blood as quickly as possible from the capillaries to the veins. They have a large lumen because we want to carry as much deoxygenated blood as possible, but they do collapse easily under pressure. So venules are small veins. Now the veins carry deoxygenated blood back to the heart, with the exception of the pulmonary vein, which carries oxygenated blood to the heart from the lungs. There are 3 layers similar to the arteries in a vein, but these are thinner because they don't have any muscle walls in the actual vein itself. They have a very large lumen. Again, they are covered in endothelial cells, but they have valves in them so that this stops the flow of blood going backwards. They vary in size. The largest is the vena cava and the pulmonary vein, and they don't have any pump in them. They don't vasodilate and vasoconstrict to the same degree as the arteries. They rely on the skeletal muscles to push the blood through the vessels back to the heart. So veins are thinner, their walls are thinner, but they have a much larger lumen, and they have valves, and they rely on the skeletal muscles to push the blood back to the heart. One of the most common questions that I might ask you is the difference between arteries and veins. And arteries carry oxygenated blood from the heart. They have a small lumen. They're pumped by the heart and the arterial muscle. They have a thick muscular elastic wall, and the nutrients are a very high concentration in the arteries. Whereas the veins carry deoxygenated blood, transport to the heart. They have a large lumen. They're pumped by skeletal muscles and valves, but they have thin non-elastic muscular walls and have a high waste concentration. Now, blood pressure production and maintenance is reliant on several things. The output of the heart, what is pumped from the left ventricle, how much blood comes out of the left ventricle makes an awful lot of difference to the blood pressure. The arterial resistance makes a great difference to blood pressure. So the greater the contraction, the higher the blood pressure will be. And this is monitored and measured by the vasomotor nerve. So the stimulation from the vasomotor nerve on the arterioles will cause a greater contraction. So the higher the contraction, the higher the blood pressure. The total blood volume running around the body, which should be 4 to 5 litres, if there's a reduction in the blood for some reason, then you'll end up with low blood pressure. But if you have fluid retention or edema, and more of that extra interstitial fluid is being dumped into the circulation, then that will increase your blood pressure. So the total blood volume running around the veins and the arteries will affect your blood pressure. Also the blood viscosity, so this is the thickness. So how much plasma proteins, how many erythrocytes are travelling around in the blood affect the viscosity. And a low viscosity means that you'll have lower blood pressure. In anemia, for instance, there might be less blood travelling around the body if you're anemic. There might be less blood cells in the body. If you're anemic, you will have a lower blood pressure. Also, the elasticity of the artery wall will affect the blood pressure. The hardening of the walls and the elasticity is lost as you get older, and that increases your blood pressure. The softer your arteries and veins, then the lower the blood pressure is likely to be. Low blood pressure is always a much better thing than high blood pressure, although if it gets too low, you do have to be careful that you don't keel over or faint on a regular basis. Systolic blood pressure, to recap, is the measure when the heart is contracting, and that's your top reading. Diastolic is when the heart is at rest, and that's the bottom reading. And on average, 90 or above is considered to be high blood pressure if it's consistent. High blood pressure is also known as hypertension. Low blood pressure is known as hypotension. So if you take the O from low and the O from hypo, that should remind you which way round it is. High blood pressure, we're not really sure why it comes about, but definitely stress, medication, smoking, alcohol, kidney disease, maybe narrowing of the arteries are all reasons why blood pressure might increase. Diet and hereditary factors definitely play a part. If your family or your parents have high blood pressure, then the chances are you will have high blood pressure as well. Long term, high blood pressure is quite dangerous, and the more risk factors you have for heart disease in terms of blood pressure, high cholesterol, obesity, diabetes, or whether you smoke, then these are all risk factors and will increase your chances of either having angina, a heart attack, a stroke, or maybe kidney complaints. So high blood pressure is certainly a risk factor in heart disease. Low blood pressure is also hereditary, and it can be also underactive adrenals. People who are in shock have short-term hypertension, and the effect of hypertension tends to be that you're likely to get a lot more dizzy and possibly faint much more often. There are 4 types of blood groups. The universal donor is O blood group. O blood can be given to everybody. The next category is B. B blood can be given to B or O people. A can be given to A or O, and AB can receive blood from anybody. O is the universal donor, so that can be given to anyone. Only 45% of the population have O rhesus blood. Blood is defined as whether it's negative or positive, but actually for the purposes of your ITEC examination, that's not something that is included in your syllabus. What you do need to know is the blood types are A, B, A and AB. That O is the universal donor, can be given to anyone. Somebody who has a B blood group can be given blood from a B or an O person. Somebody with an A blood group can receive blood from an A or an O person, and somebody with a B blood group can receive blood from anyone. That's most likely all you need on blood groups. I think this looks quite scary, this picture of arteries and veins. And although you do need to know the names of the arteries and veins in the body, most of these are quite self-explanatory. So if you have a look at the femoral artery on the leg, that's named after the femur. So a lot of these are very commonsensical. The difficult ones are the cephalic and the basilic, which you find on the arm, and the long and short saphenous vein, which you would find on the leg. They tend to be the type of questions that ITEC will ask you. Where would I find the basilic and the basilic and cephalic vein and artery? Where you have a vein, there is always going to be an artery as well. The long and short saphenous artery and vein is also what they ask you about. That's on the leg. You might also consider, do you know where the plantar arch is, which is on the foot? The dorsal venous arch, that would also be on the foot. The deep palmar arch, that would be in the palm. The carotid is in the neck. Mesenteric might not be one that you come across, but I've never known them ask that before. Mesenteric is related to the stomach. So please have a look at these, but I'm sure you'll find that really at this stage you should have a good idea where these are anyway. So it looks a little bit more scary than it is. Anemia is a reduction in the blood's ability to carry oxygen. The symptoms can often be pallor, lack of energy, listlessness, tiredness. It can be caused by either a decrease in blood cells, decrease in hemoglobin, or both, maybe a lack of iron in the diet, or a failure of the bone marrow to produce enough blood cells. And often it's hereditary. Angina also known as angina pectoris, is chest pain due to ischemia of the heart muscle. Ischemia is where there is a blockage in one of the blood vessels in the heart, which causes a lack of oxygen to the cells in a certain area, and they die essentially. And the ischemic pain, the angina pain that you feel, is because of the lack of oxygen to some cells in the heart. A lack of blood and hence oxygen supply. Glyceryl trinitrate and nitroglycerin are both preparations that you can take under your tongue, either as a tablet or a spray, to alleviate that pain.
An aneurysm is a dilation or swelling of a blood vessel where part of the vein or artery has got weaker and thinner and inflates like a balloon. This is responsible for a lot of brain hemorrhages, and we can have aneurysms and thinnings of walls in blood vessels around the body and not even know. They're quite difficult to diagnose because they don't have any symptoms. So the wall stretches and gets thinner and weaker than the rest of the wall. So an aneurysm is responsible for a lot of brain hemorrhages when you hear that somebody's died suddenly of a brain hemorrhage. Arteriosclerosis is a degenerative disease of the arteries, normally in the elderly. As we get older, you'll find that our arteries lose a lot of their elasticity along with other areas of the body, and we end up with hardening of the arteries. This then increases our blood pressure. So as you get older, it's quite natural for older people to have an increase in their blood pressure because of this degeneration of the arteries and the hardening and losing of their elasticity. So don't get arteriosclerosis muddled up with atherosclerosis. I have quite a funny way of remembering this. I tend to put an F in front of arteriosclerosis, which spells fart. And having nursed a lot of elderly people and walking behind them with their frames in the hospital over the years, it used to tickle us to death that quite often the elderly would be farting as they wandered along in front of us. So I hope you're not offended, but I tend to put an F in front of arteriosclerosis to remind myself that this is the elderly hardening of the arteries, whereas atherosclerosis, which has a similar effect and sounds very similar, if you put an F in front of that, it spells fat. And atherosclerosis, which we'll cover in a minute, is where the fat blocks the arteries. So that's how I remember those two words and the differences. As I said before, atheroma is a fatty deposit, and this is, you find it on the inner walls of blood vessels, which can cause narrowing and decrease the blood flow. Now, an atheroma is one deposit, whereas atherosclerosis, which we'll cover a bit later on, is a disease because of these fatty deposits narrowing the arteries and decreasing the blood flow. Cancer of the blood is called leukemia, and leukemia comes about because there's an overproduction of immature white blood cells. So the white blood cells are not maturing properly, so it means that they are not able to fight off the diseases that normally we would have no problem having white blood cells to produce to fight off all the bacteria, viruses that we might suffer from. So leukemia is cancer of the blood, an immature overproduction of white blood cells. Atherosclerosis is a build-up of the fat, the atheromas lining the arteries, resulting in a narrowing of the passage through the arteries and a hardening in the vessel walls, which reduces the elasticity. So very similar condition to arteriosclerosis, but that is a natural degeneration in the elderly, whereas atherosclerosis can happen at any age where there is a buildup of fat lining the arteries. And the causes are high cholesterol or fat, and this is also known as hyperlipidemia, is another name for high cholesterol. Haemophilia we discussed earlier, and haemophilia is the blood's inability to clot. So when we talked about the different components that are present in the body in order for a clot to take place, haemophilia is a genetic condition which results in one of those components being missing. So it results in minor injuries being life-threatening for somebody who's a haemophiliac. What you tend to find is it's the men that suffers from haemophilia, and it's hereditary, passed down through the mothers, the women who are the carriers, and it's the male line that actually suffers from it, and it's a defective gene on the X chromosome, the female chromosome, that's passed down through the male line. So haemophilia is the inability for the blood to clot, which can be life-threatening. Cardiac failure is when the heart loses its ability to pump blood, so it's life-threatening. Often goes hand in hand with somebody who has heart conditions and the blood stops pumping. So it might be coronary artery disease, it might be high blood pressure, it might be a faulty heart valve. There are lots of reasons why the heart might go into heart failure, but I mean, obviously it's life-threatening if the heart can't pump the blood around the body. Epistaxis is a medical term for a nosebleed. Most nosebleeds stop quite quickly, but the rule of thumb for first aid is that when a nosebleed, we check it after holding the nose for 10 minutes, and if it's not stopped after 3 periods of 10 minutes, then you should seek medical advice. It might be that nosebleed is a side effect of taking aspirin or an anticoagulant, or it might be that somebody has, picked their nose and upset the lining of the nose. Or I get quite a lot of nosebleeds because I take a nasal steroid, and apparently that's made my nose quite thin, the lining of the inside of the nose quite thin, and that's meaning that I'm getting nosebleeds when I have a bath or I get warm, and then there's a rush of blood. Gangrene is the death of body tissue due to loss of blood or blood supply, and it can be in heart disease. You might get gangrene if you've got poor circulation. It can often be an extreme side effect of diabetes, where there's problems with the peripheral circulation. And necrosis is the word for this blackened tissue that you can see, and this death of tissue in the extremities of the toes. So that's necrosis, and gangrene is the death of blood tissue due to the loss of blood and supply of blood. So it could be through heart disease. So hemorrhoids. I do apologise for the picture. It's quite graphic, but hemorrhoids are also known as piles, and this is a nasty case of piles, hemorrhoids. It's enlarged veins in the rectum or anus, which may protrude outside the anus. Can be very itchy, very painful, often caused after childbirth or when somebody's straining due to constipation. So if you want to put your hand over that picture while you're going through this slide. I know some people have been offended by this picture, but you know, every picture tells 1,000 words, and you won't forget what a hemorrhoid is after this. Hepatitis A, B, and C. So hepatitis is inflammation of the liver. Hepatic is referred to the medical term for liver. And it's highly contagious, inflammation of the liver. Hepatitis A is spread in fecal contaminated food. Hepatitis B and C are spread through the contamination of blood and body fluids. So it's caused by a virus, and we have 3 types of hepatitis. We have hepatitis A, hepatitis B, and C. And as you can see that there is a vaccine for hepatitis A and hepatitis B, but there is no vaccine and no treatment for hepatitis C. And quite often it's unsymptomatic. So it's not easy to diagnose hepatitis C. So as I mentioned before, high cholesterol is also known as hyperlipidemia, which is a buildup of cholesterol or fat in the blood. It causes a reduction in the lumen, the size of the lumen of the arteries, and can result then in arterial or atherosclerosis, which may increase blood pressure. So high cholesterol, hyperlipidemia may be a result of atherosclerosis. Then we have HIV and AIDS. HIV stands for human immunodeficiency virus, and the AIDS disease is acquired immune deficiency syndrome. So the virus attacks the T lymphocytes, causing the immune system to be unable to fight normal diseases. So these particular people who have HIV can end up suffering because they can't fight off ordinary conditions which normally our immune system would be able to fight off. These days there is a cure for HIV, and not so many people are developing the full-blown AIDS, and as a result people were passing away from AIDS. AIDS is caused by the HIV virus and transmitted through blood and other bodily fluids during intercourse. However, you can also catch AIDS through a blood transfusion, or in the past you could. Before a certain date, blood wasn't checked for the presence of HIV, but I believe that from the year 2000, I could be wrong, but I think from 2000 all blood was checked for HIV before it was transmitted and given to somebody else. So in the past, HIV would have been transmitted through bodily fluids, through intercourse. So homosexuals quite often developed AIDS by sleeping with somebody who had HIV, but also, you know, women can catch it through heterosexual sex, and you can also catch it through having blood transfusions before a certain date, or a drug addict could catch it from sharing a needle. So different ways that you can catch HIV and develop AIDS. Phlebitis is inflammation of a vein. If you think about a phlebotomist, is somebody who takes blood from patients at your local surgery at the hospital. So phleb is the Latin name for vein. So phlebitis is an itchy, painful, red rash that you can get very often on the lower parts of your extremities. And thrombophlebitis is inflammation of a vein where there's a clot as well. But it's a nasty, painful, itchy, red condition. Septicemia, which you can see in the picture bottom right, This is blood poisoning, and there's toxicity, toxic bacteria in the blood, which often is caused by septicemia. You can get septicemia when you have meningitis, certain types of meningitis. Stress also increases the heartbeat. Excessive stress, unresolved stress can lead to high blood pressure, even a heart attack. So stress really does affect the heart system, the cardiovascular system. If you hear the term thrombo or thrombus, it should automatically lead you to think about a clot. A blood clot, either in the heart or in a vessel, is called a thrombus. And a thrombus in the brain artery can cause a stroke. So it's life-threatening. And it's clots forming in the blood where we don't have a cut. So thrombosis is a clot which is much more likely to form in an artery that is already blocked with fat. So thrombosis is where you have an atheroma or atherosclerosis. Deep vein thrombosis, or a DVT, is a formation of a blood clot in the deep veins, usually in the leg. But it's actually comparatively rare. You know, we hear a lot about DVTs being developed, you know, when we're flying. So people wear sort of supportive socks and leggings. But it is very rare. It affects 1 or 2 people in 1,000, and mainly, again, in the elderly. We're also hearing about DVTs as being a possible side effect to having the coronavirus injection. But again, it's no more than anybody who gets a DVT when they're flying. Coronary thrombosis is a clot present in the coronary artery. So that can be life-threatening because if the coronary artery is blocked with a clot, then that can lead to a myocardial infarction or a heart attack. Heart disease is an umbrella term for a variety of different diseases affecting the heart and the circulation. Heart rate abnormalities can often be different arrhythmias, so an abnormal rate and rhythm of the heart. The term tachycardia comes from, is for a rapid heart rate, and the term bradycardia is a pulse rate that's below 60 beats per minute, and it's quite a slow heartbeat. You can have tachycardia temporarily after exercise and different stimulus, and the same with bradycardia. We could say that actually after sleeping heavily, sometimes you might have a bradycardia, but these terms are generally for people who have a rapid heart rate all the time or have a slow heart rate under 60 beats a minute all the time, which is bradycardia. A hole in the heart normally is through the septum. Septal defects opening into the wall of the septum between the chambers of the heart. So that would mean that your blood was, the deoxygenated blood was running into the oxygenated ventricles or atrium of the heart and vice versa. Intermittent claudication is an aching or cramping or tiredness that sometimes comes in the legs. And you can have a burning in the legs where there's intermittent blockage in the veins and the arteries. This is often associated with people who smoke heavily. So intermittent claudication is a condition usually in the legs. A myocardial infarction is another term for a heart disease, and due to the death of the heart muscle from a sudden blockage, maybe in the coronary artery, by a blood clot. So it's usually a clot that blocks one of the coronary arteries and an area of death in the heart muscle causes a heart attack. Apparently, it's a really painful condition, and people who survive a heart attack can often be depressed because of the severity of the condition and the pain that they get from it. A palpitation is when a person becomes aware of the beating of their own heart. So it can often be brought on by stress and anxiety, but it is the normal beating of the heart, and you just become aware of it. A pulmonary embolism is a clot or blockage of one of the main arteries in the lung or one of its branches. So pulmonary is the term for the lungs, and it's an embolism in the pulmonary system, so leading to the lungs or one of the branches within the lungs. Raynaud's disease is a disorder that affects the blood flow to the extremities, normally the toes or the fingers. I've never seen anybody with Raynaud's of the nose and the ears, but I have seen a lot of people, not quite as obvious as this. This is a very good picture of how different the area that's not getting the blood through can look. So this picture on the left is a classic look for the Raynaud's disease, and it can be quite uncomfortable for people, but it's not life-threatening. It's something they tend to live with. Sickle cell anemia is a serious disease in which the body makes sickle-shaped red blood cells. So the blood cells don't form properly in the blood. So they have a completely different shape, and they don't hang on to the oxygen like the red blood cells normally do. Thalassemia is an inherited disease of the red blood cells. Again, different shape and size, and it's an inherited disease of the red blood cells. Varicose veins. Varicose veins are where the valves are no longer working in the veins in the leg. They've collapsed, resulting in the veins becoming dilated and often with distended and knobbly lumps in the veins. This is what we can see in the picture top left, showing through the skin. And varicose veins can be fatal if you actually burst a varicose vein. They tended in the past to be stripped, where they would put in something very similar to a sort of wire and push through the veins and clear the veins so that they didn't have any clots left in them, or otherwise you could have a varicose vein like a bypass. Luckily, we have different veins through the legs, so that if one becomes varicose, there's usually another alternative for the blood to supply that area. But it can be hereditary, so if your parents have had varicose veins, you could be very prone to developing them yourself. A lot of people get varicose veins in pregnancy, which then disappear afterwards. Obesity puts extra strain on the veins, and prolonged standing or sitting can cause varicose veins as well. So putting your legs up at the end of the day higher than your bottom can really alleviate the pressure on the blood and prevent varicose veins. Varicose ulcers, and we can see here in the picture bottom left, this is a chronic ulcerative condition, usually around the ankles due to varicose veins or very poor circulation of the extremities. And because the circulation is very poor in this area, it's already maybe very black and blue. When somebody knocks their leg, it takes an inordinate amount of time to heal. Very difficult to heal varicose ulcers, but I have had some success with healing them with essential oils as an aromatherapist, so that's been quite interesting. So varicose veins are usually in the legs. Varicose ulcers are normally just above the ankle where they have difficulty healing. So it's an ulcerated condition.